your autonomic nervous system develops way back in infanthood. And so you carry this subconscious energy and emotion around events and environments, where when you are all the way grown, it still triggers you because it triggers your autonomic immune system below your consciousness, right? Building up, processing trauma, where we're finding that work that should have been done way back in early adulthood, older adults are now realizing, I never really processed that.
With this podcast, what we're trying to do is have real, authentic discourse.
Dr. Taylor, it's good to have you today. We've worked together for a couple of years now, and really excited to have you on our show. So as you know, this is our podcast. We launched it this year. It's called Treatment Redefined, and our objective is to have good, candid, honest conversation around addiction and mental health treatment, which, as you know, that involves the overall internal medicine and physical health of patients. So I'm excited today to explore some subjects with you.
Thank you for having me.
Just to kind of parlay some of this thinking, we're working with you, you're working with us, and we're in the space, Enterhealth is in the space of addiction and mental health.
Yeah.
And where I feel like this comes in, and I want to banter with you on this a little bit, is there's a big medical component to patients that are suffering from addiction.
Yeah.
And often there's with mental health too. Yeah. But what people often don't realize is that people that are suffering from addiction have underlying comorbidities. They also have underlying issues, often related to mental health.
Right.
They call it dual diagnosis. Yeah. Most often it's generalized anxiety disorder, major depressive disorder, other sorts of things that are bothering them.
Yeah.
That sometimes, it's always tough to tell if it's the chicken or the egg, but often it's fueling their need to use because they're trying to get relief from the symptoms and the way that they feel.
Right.
So in our space of addiction treatment, mental health treatment, you have certain professionals that really do the work, right? You have therapy, and they're working on a lot of the emotional issues, family issues, trauma issues. They're kind of like the ground soldiers in there working with you. Then you have your physicians, primarily psychiatrists, play the role in residential treatment, outpatient treatments. And where I feel like our worlds have kind of come together a little bit is bringing the thinking, and a lot of it was spurred by Dr. James Greenblatt, who has worked with us most of this year to help stand some of these ideas up through the Psychiatry Redefined platform that he has. But I really like the thinking that he has tried to, promulgate across our country, which is we need to get away from just treating symptoms and really look at the root cause of those symptoms. That is, and that's an easy thing to say, but it's very difficult actually to do. But that's actually what we're trying to do, because psychiatry in most treatment centers and historically is I sit down with you, I listen to your symptoms, I'm thinking about what I think I know in my history, and really what I'm going to go to, because most of them, I'm generalized, but most won't do therapy. That's abdicated to therapists. Right. Somewhere along the way, psychiatrists stopped doing therapy. Right. That's a different discussion. Right. But they're going to go to their medication pad, and we're going to try things, and most of the time you have to try things, and it takes time, and there's side effects with those. Right. So at the end of the day, and I'm not saying it doesn't work, because I've seen it work, but it's only attacking a little bit of the problem. You're really mollifying the symptoms, your symptom management to get you on your way, going back to all the people I've got to see every day. I got to get you moving, and get you probably to a therapist to work on those major issues. Where you come together with us is really the thinking of, let's look beyond and let's spend a little bit more time. Okay, what is going on here? What other types of things could be happening that are actually making you present with psychiatric symptoms? Right. These worlds come together, don't they?
Right. So basically you want to widen the aperture, right, so that you consider the whole human. And I think that we all intuitively know that. I think if you talk to anybody, they intuitively understand that.
Yes.
Right? But in medicine, that's not how the system has been set up, because we have specialists. You have a psychiatrist that does that, an endocrinologist that does that, cardiologist that does, and we don't get paid to talk to each other.
That's right.
Basically, the specialists don't get paid to talk. So there is no integration of the care. Mm-hmm. Ideally, your family practice or your internal medicine doctor or pediatrician is supposed to do that. And some do. But the reimbursement for that is so low or non-existent that practically they can't do it, even though they know how, they're supposed to, they want to, right? So what we're trying to do is exactly acknowledge that. You want to set the terrain, your body up for success, your brain up for success, so that any treatments that you do land better.
Yep.
Right. So if the soil is more fertile, it's well watered. When you plant a seed, call it a medication, an intervention, whether it's MERD, whatever you do, therapy, exercise, the soil is ready to receive that treatment, and you can thrive on that treatment. So it's not an either or, it's a both and.
That's right.
Right. Precision medicine now comes into that we're starting to do here, which is very exciting, is looking at your genetics, the genomics, right? That how you use your genes to treat, to dictate treatment.
Yep.
And, what that kind of means is, okay, if we notice that you have an enzyme that's a little sluggish, that was probably adaptive, evolutionarily, but now it's maybe maladaptive because there's lights everywhere and you didn't need to have as, much focus or whatnot. How can we recognize that and offer a medication that deals with that?
Yeah.
To date, it's been, we're going to just throw things on the wall and see what sticks. And to your point, well, we're not going to know if it works for 6 to 8 weeks.
Right.
There is increased suicidality, ideation potentially during that time.
Yep.
You may feel worse if it's not going to work. And if you do it sequential, then you can see how long it may take, because how many medications do we have to try? If you do 2 or 3 at a time, you don't know which one's working, which one's not, and then you amplify potential side effects. So can we do it with a little bit more precision, where we look at your genes, we say this is your enzyme composition, and we can totally do that, and then offer directed nutraceuticals, which are your nutritional base, like supplements, dietary plan, because food is medicine. We know that a lot of the enzymes in our body require magnesium and B vitamins. Well, if you don't take a lot of magnesium in, or your body doesn't process B vitamins, you may take them in, but your body doesn't process them, or the enzymes need higher doses because they're sluggish. We don't look for that. We're just giving you the SSRI, and we're not even addressing the fact that we're trying to get the engines of the mitochondria to do what they do, but they don't have the tools, the fuel, the substrate to produce the energy.
Yeah. So we're in there really repairing the soil so that when we apply the medication, right? And the thing I love about what we're talking about, because this is just an opinion, I've always felt like this alternative functional medicine has always been, it's either that or it's traditional Western medicine. Right. But to me, the opportunity is these worlds work together.
100%.
Because if we can prepare the soil, look at all the different things going on maybe biochemically with you, and you and I, if we ran these tests, would probably have much different things. And you would say, Dave, we need to repair this, this, and this in order for this SSRI to work more effectively.
Right.
But that could be maybe the single biggest reason that people say, well, I had to try 2 or 3 of them, and I had trouble. The third one finally worked.
Right.
Well, maybe the first one actually might have worked if we would have worked on the other things.
Right.
And it might have been the better solution for you in the first place.
Right. Or maybe you need higher doses, right, or lower doses. Some people, their enzymes may break down a hormone or a medication, a drug, quickly. So you need to dose more frequently, because most of your living time is going to be spent in a deficit of that support that you think that you have with the medication. Or on the contrary, if I break down the drug really slowly, my liver detoxifies that particular drug very slowly, and I dose it every day or twice a day, or the dose is higher instead of lower, then I'm going to have all the side effects, right? And I'm not going to, even if the drug is kind of doing what it should be doing, I don't like the way that I feel. So I'm going to maybe self-medicate, or I'm not going to take it.
Exactly.
So it's not going to be effective.
Yep.
So we need to get, it shouldn't be niche. It shouldn't be special. It should be basic. It should be a part of how we do medicine.
I think you're so right.
Yeah.
I do. Hey, just kind of on a quick note on this, when you think about, because I think about like our patient population, we primarily serve adults. This plays really, I think, really importantly into the fact that, our population, say at our residential level, tends to be kind of that broken into categories of sort of that 18 to late 20s. Mm-hmm. And then you've got sort of your 40s to 50 and then 50 to 70. Mm-hmm. When you start looking at how people age mm-hmm. and you start getting into maybe a little bit more, say, the GERI population, mm-hmm. isn't it really important to be looking at all of these things holistically if you're going to be applying, different types of psychiatric medications to them, because their bodies are different in terms of how they metabolize things or just what's going on, right?
And the reasons why they do things, like one thing that was interesting to me as a mother, I remember reading something, if you can keep your kids away from drugs and with positive coping mechanisms away from trauma during these formative years. And those exact years are debatable, individualistic, mm-hmm. gender-based, a lot of, but we agree that if you can get past childhood intact, mm-hmm. then your likelihood of being successful mentally, emotionally skyrockets. Mm-hmm. And this is part of the reason why we want to keep drugs out of the hands of kids and alcohol out of the hands of kids, because you fall back on coping mechanisms that you've established in childhood.
That's a good point.
And there are very good studies that show your autonomic nervous system develops way back in infanthood. And so you carry this subconscious energy and emotion around events and environments, mm-hmm. where when you are all the way grown, it still triggers you because it triggers your autonomic immune mm-hmm. system below your consciousness, right? Mm-hmm. So if we know that, then we're addressing your 15 to 25-year-olds differently than we're addressing your 65 to 75-year-olds. Yeah. They're a different stage of life. So the medications that you use may be different, or you maybe use different doses, or your therapy techniques are different, and your focus is different. So, building up, processing trauma, where we're finding that work that should have been done way back in early adulthood, older adults are now realizing, I never really process that. And mm-hmm. what does that mean, process, mm-hmm. right? Like bring it back forward and relive it? Mm-hmm. Not necessarily, maybe not. It may not be something you remember. Mm-hmm. It's a feeling that you got, right?
Right.
So even like women, for instance, I think that a lot of women may have an experience with this, if not personally, through friends or family, because it's so pervasive, where I don't want to be seen this. I'm going to put my jacket or sweatshirt on, or, with this person, this energy, or in this space. Yep. Nothing ever happened to you in that space, mm-hmm. or a person like that never did anything to you. Mm-hmm. But because of the way you felt at some point in your life, right? You felt assaulted, or you mm-hmm. felt unsafe. Mm-hmm. Now, when it's replicated, even though you're safe now, and you're safe, yep. you don't even know why you feel this way. Yep. Your heart starts beating, mm-hmm. you feel some anxiety, maybe you start sweating, mm-hmm. and you're with this new guy. Mm-hmm. This new guy didn't do what the other guy did,
Right.
So we all probably have some experience with that. But when mm-hmm. it's something that's very traumatic, you can see how I can easily get over myself if I'm with this guy, but I was with this guy. I can rationalize mm-hmm. that away. But if it's something more traumatic, it's harder to do. And if you don't know that there could possibly be a connection, you can't address it.
I think, you bring up a good point. I think there's a real argument to be made that we need to focus a lot on treatments for that kind of adolescent type age group. We're here in Texas, we're in Dallas-Fort Worth, and we get calls all the time about where's a good place to send, because we have a hurting youth population. Yeah. That's a subject for a different conversation, but there's a lot of teens and young adults that are hurting emotionally and mentally. Yeah. And there is not a lot of great treatment programs for them to go to. And I've been trying to explore what's the main reasons why. And I think there's a lot of practitioners that just don't want to play in it, to be quite honest. It's difficult. It's hard. Right. But, I have a heart for it because, as you get older, you realize things that may happen to you when you're young, they can be blips on the radar screen. Right. You have a young adult, somebody in their teens, maybe goes through a challenging time period, early 20s. If you had those same set of problems with somebody maybe in their late 40s, 50s, you can have real consequences then, right? You lose your job, you have infidelity, you get divorced, you have broken family, you now have stuff that is going to be around for a while. But when you're 14, 15, 12, 20, 22, you could be sitting at my age looking back saying, it actually developed a lot of resilience through that. I got stronger for it. And you didn't have giant consequences. But I don't think there's enough focus on that population. Maybe someday we talk about it internally. That's something that Enterhealth tries to take on, because I think being able to bring a really well-rounded, holistic, excellent treatment program that has very firm family involvement is exactly what our youth needs right now.
100%. And I know that Oprah started a school in South Africa, and one of the reasons she said that she did that was because, and not here, was because the environment is easier to control. She can take the girls, I think it's a school for girls, away from their environment and really kind of shape them. Not that we're suggesting Enterhealth does that, but to the point, being able to take the young people and give them the skills, the coping mechanisms that they can fall back on. Right. And it's not alcohol, it's not marijuana, right? It's not anger, it's not cutting and things that, they do. I know that the social media, and we bring that up a lot, plays a role, depending, we talked about with AI, I think it was chat that kind of gave the young, relatively young person, 16, right?
I think that's right.
Advice on how to execute or commit suicide,
Right.
And, with this agreement and so forth. And that's out there, right? So how do you shield your kids from that? How do you offer alternatives? I don't have all the perfect answers to that. I have kids, and all I know to do is take their phone and just say,
I know,
let me have it, right?
And schools are starting to try to do that now.
Right. And then you take the phone, but, I have teenagers, and, you take their phone and then they raccoon it up out the trash. I was like, I literally threw that in the trash can. You went in the outside trash can and raccooned up that. So it's just like almost like an addiction. I mean, I think that people would argue that social
100%.
media and phones are an addiction, right? And that's their coping. So what messages are they getting from their algorithm that they're being fed that they are not enough or they're better than everybody? It's funny.
It's funny you bring it up because, I mean, as you know my family actually pretty well, and I've got two girls, and they're a little older, 23 and 22, and then a boy that's 18. And I was actually having this conversation with my girls the other day after that tragedy that happened with Charlie Kirk, and just how quickly all of that information spread. And of course, it's, my son's coming out of school and it's blowing up his phone, and before he knows it, he's seeing things that I just wished his eyes never would have laid eyes on, right? Yeah. But we were having this conversation, and actually one of my daughters, the 22-year-old, was saying, listen, I'm actually feeling like I need to make sure I keep some space from it. And I'm seeing that a little bit in some of that age group, like my older daughter and her boyfriend, different people that talk, they're like, I find them starting to put those boundaries up of, I need to push it away so that this isn't becoming a coping mechanism or I'm just infiltrated with it. Because I think I don't think our brains are really designed to constantly be fed. Right. Sometimes you just need some solace, some time to process everything that's happening. I mean, I can't tell you how many times that I'll have a period or a season in work or life where I just take maybe a day or two, and I'm without the device. Right. I'm usually kind of in some sort of nature, maybe the lake or the mountains, whatever it might be. Right. And I feel like so many things that I was struggling with, and just maybe I'm anxious about something or I'm just not sure what to do, seem so simple and clear thought after I've had that time to kind of get away from it. Yeah. I think we need to focus on those things with this younger age group, or they're going to develop these, like you said, these inherent ways. This is the way I cope. So when I'm older, I'll go back to being addicted to things like this.
Right. Well, I think, I did a lot of my time here in the east of the Metroplex. So not quite East Texas, but east of the Metroplex. So it's a very homogeneous population. And I am a different type of doctor. I look different. I'm a different gender than what they're used to. And one thing that reaffirmed is that we are all so much alike. We all want the exact same things out of life. I want my kids to be happy and safe. I want to be able to eat food that I like. I want my house to work and stop breaking. I want, I want to feel love. Like we all want the exact same things, right? And even when you start getting into conversations about politics, or I find that everybody is just trying to understand and support what they think will get them the safety and security and love, which is what we all want. They just see it through a different lens, which we all see things through a different lens. So I say that to say that I think that stepping away is good for all age groups, but more than stepping away, if we could zoom out and kind of ascend over and look at how humans are behaving, like why is all this division being created in the first place? Who's gaining from? It's not me. It's not you. It's not anybody that I know or talk to. So what is all this division? Like on the media, we see the most extreme caricatures of any group, and it gives us they give us the rhetoric to spew hate and division.
That's right.
But when you're young, that just intuitively doesn't feel right. Like you haven't been here long enough to be indoctrinated with hate.
100%.
So you are 16 or 20, and it's harder because you're like, I don't understand why we hate those people. I don't understand. I don't care enough. Like what they're saying, they're just, they don't represent anybody that I know.
It's like a healthy naivete that they still have. It's that's something we learn over time.
Something we learn. Yeah.
Right, and it's actually one of the big reasons I love my kids. I grew up, a lot of them have played sports. My son still does it pretty actively. It's like you run with a lot of different types of people, and you just get to know them on a different level, and you don't have all of these different types of voices in your head triggering you a certain way. But I am, and I watch the news incessantly and try to keep up, but I try to be as objective as I can, and I just think you've got to be careful with some of this, because I have the privilege of working with a lot of different types of people, right? That don't believe, maybe we may have different political opinions on this or that, or different faiths, whatever it might be. Yeah. But what I have found nearly every single time is that when I sit down with these people, like we're talking, like we agree on really like 98% of life, right? And actually the areas where we might disagree, I can kind of see some points of view and they can see mine, and I don't really have any personal anger towards this person, and we can coexist. We're being infiltrated and triggered all along the way through social media, through the media in general, and I don't know. I mean, this is probably its own topic, but I just wish some of that stuff could stay at bay and we could have just more dialogue and just intellectual conversation with people, because I agree with you. I think people want the same thing.
We're so alike, and the people that are telling us how to think, whoever those people are, whatever news you watch, whatever millionaire or billionaire or whatever, they don't know anything about us. They don't know. We know more about each other than we know about them or they us. It doesn't matter what they look like, where they're from, what their religion is. They don't know us. They don't know our life. I know your life. You know my life better than any of them. And so to listen to them to tell me how to feel about or think about those that group of people or this political ideology, you have to be a critical thinker in all the spaces. So it's not just in medicine where, you kind of pull back like, well, this doesn't make sense. It's also in life. And so, I'm hoping that my kids, but all of our kids can, to your point, zoom out and see, I can think that Black people are like this thing that we see on TV. Or I know Myeisha, and she's pretty cool people. She's kind of funny. She's a ray of sunshine everywhere.
which you are. I've known you a while, and you definitely are that.
And that would be a more accurate portrayal than anything that they're showing you on TV. Who is this person on TV? Is that person really a person on TV? Like, I love to like entertain conspiracy theories, right? Like, so sometimes I'm like, I don't even think that's like a real person. I think that that's an actor. I mean, did we really go to the moon? Like, is Antarctica? I mean, there's Godzilla. I think he really probably
And my
lives
wife
there.
was coming at me about the moon thing a couple of months ago.
My grandmother does not think the moon. She does not believe. She did not believe any of that. She also kept her money in her mattress, but she does not believe any of that, and she was clear about that. So I say that to say that sometimes it's not all or nothing. Maybe there are puppet masters, right, dictating the behavior of a society.
Yep.
Period.
Yep.
Who are they? And why do they need division and war? Is it to money? I think the money is too simplistic of a common denominator. What is it? Influence? Control? I don't know what it is.
I don't know what it is, but it's probably maybe a combination of some of those. Power, control, money.
Yeah.
But I really feel like just to kind of this is such an interesting dialogue to have with you, but to bring it kind of around, that's why I think we need good independent thinkers in our healthcare system that can advocate for their patients, that really... They're like you and I, we have a patient-doctor relationship, and your primary goal is to give me the best advice, and you don't have people basically pushing an agenda through you. Right. And I think physicians need to be very, very independent there.
Me too.
And when it comes to things like what we're doing, mental health, addiction, it's complicated.
Yeah.
This is not an acute issue where I can just see that you have an infection and I give you a medication and we get over this. There's a lot that takes place here. It's one of these if you know, you know, because you have to throw a lot at it, and you can't. It's not a quick fix.
Right.
I really feel like one of the biggest missing ingredients that has been in the mental health space has been having great doctors that understand the overall body and how this interrelates with one's mental health. Yeah. We were having a dinner. This was about a month and a half ago, and sometimes I will throw out some hot sports opinions at these dinner, and I don't know exactly how they lie, but there was a few psychiatrists there. I love them. We have a great psychiatrist that we work with, but the one that was at the dinner, I said, listen, I could be wrong on this, but I really feel like the area of psychiatry, people that are suffering from mental, emotional issues, the field is running more from you in two credible professionals that understand the interrelation of the mind and the body and how to help both. I really believe that. I think it's easier to learn the SSRIs and the medications and what they do and don't do. I mean, if really what I'm doing is have a handful of medications I know that work and I spend 15 minutes with you, I think people can learn that. Yeah. I really believe that. I'm not trying to minimize it. Right. But this over here is more complicated. Right. It's really like base medical school, but it's also, you got to be pretty smart and be able, like you said, to look at all the, I'm not a specialist, all the stars in the sky. Right. I think behavioral health needs that type of approach. Right. Because you got to unpack all sorts of things, traumas, and relationship issues, and then there's biological issues that are exacerbating potentially your mental health symptoms. Right. And I think, so I wanted you maybe just to hit on this just a little bit, is that sometimes when we had this dinner, one of the doctors says, what is it that you're really doing? Yeah. He was curious because he's been doing psychiatry for so long. Right. And it was, hey, he's used to patients coming in 15 minutes, give them some medication, come back and see me at 6 weeks. If it didn't work, and we'll change it. Yeah. He's like, what are you doing? Yeah. And I was trying to describe to him, we're actually investigating. There's more to this than what you think. Yeah. We may have patients that come to us, and through your evaluation, through your testing, you might find that there's other things going on that necessarily, this isn't necessarily a psychiatric diagnosis, but it could have psychiatric symptoms related to it, right? Right. There's things like that that you will discover. Right.
One huge example that I've been talking a lot about lately is menopause and perimenopause, for instance.
Exactly.
People will have, anxiety, depression, rage, relationships. It's the highest dissolution time of a marriage is during perimenopause, right? So women who are between the ages of 50 and 60 initiate divorce 80% of the time, right? So this is a family
That's
issue.
an interesting stat, actually.
Family problem, a man problem, right? I can imagine as a man, you're like living your best life on cruise control. Then all of a sudden, seems like your wife is not happy with anything you do ever, right. And rage and, so forth and so on. And it just gets in the way of what the plan that you had for the rest of your life, which is we're going to get old and sit in the rocking chairs and die together on the porch, because that's everybody's plan, right, for the rest of their life.
Yep.
And watch the grandkids play. How traumatic would that be to be in the rocking chair? Grandma, grandpa are dead.
That's the way we want it.
But that is the way we want it, right? And it gets in the way of that. And, being the matriarch and patriarch of a family, it all dissolves. And so it's a problem that we fail to address. And a whole generation of women, we did not even entertain the thought that maybe estradiol, testosterone, and progesterone are neuroendocrine molecules and not just sex hormones.
Right.
And so we don't check, but we do acknowledge, there's roid rage. We acknowledge that hormones do things. We acknowledge inappropriately often PMS. Oh, her period must be coming. And get dismissed at work. So we acknowledge that there are hormonal factors at play in the expression of yourself and your mental health, but we don't test for it.
That's right.
We don't optimize it. We don't acknowledge it. Psychiatrists don't typically do that.
No,
and
we don't touch it.
We don't touch it. So you have a psychiatrist that's like, well, what is it that you do? You're kind of like you're doing holistic medicine, integrative medicine, where, let's check your thyroid. Like you think you're depressed, but if you're hypothyroid, thyroid hormone is kind of what gets you up and going and kind of is the whip, or the megaphone to your cells. Okay, let's do this metabolic. Let's do what you do. If you don't have enough thyroid hormone, then getting out of bed could be difficult. Activities, exercise could be difficult, right? But if we just throw a SSRI at you, will it help? Maybe. But if we don't fix the thyroid, it's not going to get you back to where you need to be.
That's right.
Right? So they're not mutually exclusive. But let's look at the thyroid. Let's look at the adrenals. Let's look at the hormone milieu.
That's right.
That sort of thing.
I think that population, that kind of premenopausal, that age group that you're talking about, I think there are so many people dealing with that.
Yeah. Yeah.
And they don't get, they're not getting the right attention.
They're not.
So you might not be treating the correct problem.
No. Every woman from the ages 35 and up, I'm hyper-focused on how are your hormones, right? With men, it's a little bit later and their decline is more gradual, right? Women, it's just, we fall over a cliff, right? The ovaries just fail, and it's sudden. And before it falls, it's sporadic, which is probably worse than just leaving already, right? It's like somebody that comes in the room and like yells and then goes and slams the door and comes back and it's like, just go. Just go already.
Yep.
That's not what's happening for 10 years sometimes for women between the ages of 45 and 55 or 40 and 50. So can we look at that and address that, right? Your nutritional status. If you don't have the cofactors, if you don't have the input, the substrate to produce the energy,
right?
Your cells don't have that, then you're not going to function properly. You're not going to have the wherewithal to be able to do an exercise plan or a dietary plan or even take your medications. What you're going to do is you're going to self-medicate so that you can alleviate your suffering, right? So if we can address the nutritional deficiencies, balance the hormones, right? Get the energy sources up, right? So we support the mitochondria, which are your powerhouse of the cell. So let's support them so they can support us. And that's kind of the gist of what we do. Look at inflammation is kind of causing those engines to just run, right? If they can't clear the smoke in the room, because every engine is going to produce heat or light or something, right?
Yep.
So can we clear that out with antioxidation? Now, if you've depleted it, then we need to know that and we can test for that and give you antioxidants. If you haven't, and that's not your issue, we don't have to throw those particular supplements or food products at you. You still need them, but we can focus on whatever is the issue.
Yep.
So it's, nuance, but it's broad-based, right? It's controlling inflammation, detoxifying, antioxidant type. It's balancing hormones, making sure, and balancing hormones also comes into play with insulin, metabolic health, right? Because certain types of hormones can cause weight gain, weight loss, peptides, like insulin's a peptide. I know we talk about the other peptides, but insulin's a peptide, right? Just a little short chain, amino acid. So looking at all this, and you need time, right? Like that's the thing.
Very unique time.
And it comes back to that. Like it always, everything's going to come back to that time. Does the doctor have time to think, to study, to do research on you, to see how your genetics fits into your hormone situation, into your lifestyle and the things you did or didn't do in terms of drug use, substance use, medications, family history, environment, where are you from, what, infectious diseases have you had, because sometimes those can linger, right, in your body. So we want to take that into consideration. So when there is stress and, cold sores is herpes, flares, like it's a bad name, but it's a very common. What is it? Does it just flare where we're seeing it? Or is it the immune system kind of dipping so other things are flaring and presenting in a different way?
That's right.
We don't even look.
Yep.
And we don't even look. We don't, And not only do we not look, because you can't look for all the things because it's $1 million workup, we don't even consider it.
Right.
Because sometimes you can offer solutions just in case because they're safe. Oh, well, let's try this curcumin, like for inflammation. It's not going to hurt you, it might help. We don't even think that way.
That's right.
And doctors are not really in the mindset of offering nutrition, food, and supplements as treatment. It's pharmaceutical based because that's what funds our medical school education.
It seems so basic, but it's so right.
Right.
And it's a comprehensive way to attack it.
Right.
And the medications, like you said, they might be right.
Right.
But we need to do these other things too.
So they can work.
That's right.
And if you do the other things, then maybe you don't have to stay on the medications forever, right? Because sometimes people will have something and, I'm like, well, it's not like you have a trazodone deficiency, right? Like there's something else going on, right? So, I mean, in the conventional medicine, I think what Dr. Attia calls it, medicine 2.0?
Yep, I think that's right, 2.0, yeah.
We've done a fantastic job of acute care medicine and globally. Like, if your appendix is about to rupture, or your leg is, injured, you want to go to the hospital, we are great at putting your leg back on or, taking out your appendix with skill, and precision. But we are not so good at what medicine 3.0, the next version of it, where we have vaccination, sanitation at 1.0, and we're not just putting dirt on it, and taking Robitussin, whatever our grandparents used to tell us to do. We're a little bit better than that, but we're still not done. And I think that that's the point. It's not to disparage what exists, truly, right? I mean, it's phenomenal what exists, but there's large missing pieces that when you start to try to acknowledge, you get pushback.
I think you're right on. I think you're right on. It feels like, again, the timing is good.
Yeah.
Sometimes it's a great idea.
Yeah.
10 years ago, there were people that were advocating for this.
Yeah.
But it's in the public now.
Yeah.
I mean, I can't tell you, everybody I talk to in our community, they're very open-minded on this, and they tend to agree, and they're seeking out practitioners that believe the way you're talking.
Yeah.
And I'm a believer in it.
Yeah.
So that's why we're trying to integrate this in and go on this journey together.
Yeah, it's the only way to do it.
It's the only way to do it. Yeah. Okay, so as we this has been a great conversation. We're definitely going to do another subject together. Yeah. But as we kind of conclude, in your mind, when you're like where we are right now, what are some things that you see? Do you see some things on the horizon that you're just paying attention to? I mean, you and I sometimes will trade emails or texts on different things, but do you see any interesting things that are developments that are happening that you're like, hey, I'm kind of curious about that. I'm just going to throw out some hot ones, like some psychedelics, stem cells for a variety of different issues. Like, what are you kind of, in your mind, keeping a lookout for that you say there could be some promise in here, or maybe even technology?
Yeah. Well, the psychedelics are interesting because they're ancient, right? Like we're talking about their emergence, like they haven't been a core staple in Native American traditions and so forth since documented history. So I think that there is a place for them, and I would love to see. I don't know if we could do it here, but if we can, we can look into that. But what it does is it allows you to, again, kind of elevate your perspective. So it removes you from the immediate, and it allows your brain to see a different perspective so that you can plant new ideas and rewire and solidify around those ideas. So I think that there is great potential, and I think that the ketamine is attempting to do that, but we have, ancient wisdom that guides us on things better than ketamine even.
Right.
And then I do like the AI. It's really great. We do work with a company, Intellect's DNA.
That's right.
Which is phenomenal, right? I had a test patient so that I'm able to see all of the things that they offer. And I'm just very intrigued because when you go into the platform, you can see the genetic composition of different enzymes that they deem valuable, the problem with them, and how to support them with medication, but also with supplements and diet.
Okay.
So you can check boxes and send that to the patient. So the reason why I bring that up is because it means that physicians, practitioners, don't have to know all the things. I don't have to know all of the genes, as if that's possible, that do all of the things that code for all of the enzymes.
Right.
If we can get AI, and then I can get the genes that matter, and that list is going to expand over time, so AI integration will get better, then we can customize precision medicine, right? Yeah. And that's very exciting. So that's brand new here.
Absolutely. Brand new.
We're doing.
That's right.
Yes, I love that. The stem cells are interesting because the concept is, you have the ultimate stem cell, the egg and sperm forming, and now it can form all the tissues in our body, which is pretty phenomenal, right? Like that magic. But when you do stem cells later in life, they can't form all of the tissues, but they can divide up into various different types of tissues. And depending on how far up they are close to the progenitor cell, they can do more things. So if you do, stem cells out of the blood, they're only going to be able to make certain types of tissues and cells. But if we can refine that, then we can repair processes.
Right.
Now, I'm not really sure how that works in psychiatry yet, but in medicine, it's used, especially in pain and, injury recovery and whatnot. We know a lot about that.
Yep.
What else? I think those are two. You gave me those two ideas.
Yeah, those are kind of the big ones. Yeah. Well, hey, I have to tell you, this has been a ball to have you on here.
Yeah.
I really have enjoyed getting to know you. This has been a great discussion. And we're going to have you back on. We're going to have some other subjects we're going to talk about.
It's going to be fun. And we use no profanity.
Hey,
we kept it above board.
Yeah, no, we keep that one on the side.
Later episodes, right?
Yeah, when we get more comfortable with this, we'll let loose. But no, I just want to thank you for joining us, and more than anything, I just thank you for the work that you do. Yeah. And I listen to you, and there's other people that have the same heart and mind, kind of like you do. And I'm just thankful that there are doctors out there that want to practice this way. Yeah. And I think God's given you a gift, and I just thank you for working on it.
Thank you.
So thank you for being on our show.
Yeah, thank you.